All righty, welcome everyone. Good afternoon. Thank you for joining us today. We'll get started. It's about 1:30. Welcome to today's co-hosted webinar, Digital Equity is Health Equity, Opportunities to Drive Change for Healthy Families and Equitable Communities. My name is Emily Cosillo, and I'm the Director of Programs for Insure the Uninsured Project, or as we're better known, ITUP. ITUP is co-hosting this webinar with our friends at the Children's Partnership, who will introduce themselves in a moment. Before we get started, we have a couple important housekeeping notes for you. First off, this forum is being recorded and will be available on the ITUP Policy Forums webpage. Attendees can listen to this webinar through their computers or by dialing in using the number and passcode provided by the Zoom software. We also welcome you to utilize the closed captioning function. Just click on the CC button at the bottom of your screen to enable the live transcription feature. If you have questions during this forum, you don't have to wait until the end of each panel or presentation to submit. We encourage you to submit your questions using the question and answer panel, which you can also find at the bottom of your screen. When submitting a question, please indicate if it is directed at a specific speaker. We will answer as many questions as we can throughout today's forum. Also located at the bottom of your screen is the chat panel. Please feel free to use this chat function to say hello or chat with other attendees. We will also be posting relevant information and links throughout the forum here. Now, a little bit about us. So if you're unfamiliar with ITUP, we are a over 25-year-old health policy nonprofit and convener. We have three key focus areas: coverage and access, and keeping with our original goal of ensuring the uninsured; delivery system transformation; and the future of health and the health system. To advance our policy priorities, each year, ITUP hosts a variety of convenings, including our annual conference and over a dozen policy and regional work groups across the state, from San Diego to Humboldt. We host online 360-degree forums and webinars. Thank you all for being here today, and publish in-depth issue briefs and high-level policy fact sheets. So speaking of issue briefs and fact sheets, one of the reasons the Children's Partnership and ITUP are co-hosting this informative webinar today is because we both recently released complementary publications on the importance of addressing digital equity disparities to increase health outcomes for California families and communities. TCP and ITUP have been partners in other health spaces for many years, and ITUP is very grateful for TCP's partnership in this new and evolving arena. I think we all know, in order to successfully move the needle on this issue, like many issues, dedicated collaborations and partnerships will be essential in achieving digital equity across all Californian communities. So with that, it is my distinct pleasure to introduce you all to Maddie Ribble, Policy Director, Social Drivers of Health at the Children's Partnership. Thank you again for your partnership. Maddie, take it away.
Well, hello. Thank you so much, Emily. Really appreciate your work and ITUP's work on this broader issue of digital equity, and really appreciate your partnership in today's event. And thank you for everyone who's joined us today. As Emily mentioned, my name is Maddie Ribble. I serve as the Policy Director for Social Drivers of Health at the Children's Partnership, also known as TCP. Next slide, please. TCP, if you don't know us, we are a California statewide advocacy organization working to advance health equity and racial justice for California's children and the communities where California's children live. We do this through research, policy, and community engagement, and one of our top issue area priorities is digital equity. In this first section of our agenda today, we're going to cover the basics of digital equity as it relates to better health and more equitable health outcomes. I'm going to share a little bit of information first, and then I'll turn it over to my colleague Marissa from ITUP. And the second and third parts of the agenda, we're really going to dig into more actionable, timely action opportunities in California where we can collaborate to advance digital equity. The brief that TCP published last week that Emily mentioned is the third in a series of briefs examining the pervasive impacts of institutional racism on the health and well-being of our children. We created this brief on digital equity to serve as a resource for advocacy. So we hope you'll take some time to read it. We hope you'll enjoy it and learn something new. Frankly, we hope you'll be mad when you read it, because of the scale and the impact of digital inequities, which are so great. But most importantly, we hope it will give you tools to get involved and help drive the change that we so desperately need in California. As my title implies, my role at TCP is to work to address the social drivers of health that impact the lives of children and communities. And as many of you know, social drivers of health refers to the upstream conditions in our communities, in our schools, in our workplaces, which drive health outcomes. We have a voluminous research literature at this point showing that it is these community conditions that drive most of our health outcomes and which undergird the glaring health inequities in our state and our nation. These are things like access to affordable, stable housing, freedom from air pollution and environmental toxins, access to healthy, affordable food, quality education, and so many others. At one time, maybe not all that long ago, we might have considered digital access a luxury, but that's simply not the case anymore. Today, there is no doubt that digital access is a core social driver of health in our communities. In fact, we think of digital equity as a super social determinant of health, which I'll talk about in a few moments. But first, what is digital equity? Next slide, please. This is a definition that we use from our friends at the National Digital Inclusion Alliance, which is that digital equity refers to the conditions in which all individuals and communities have the information technology capacity needed for full participation in our society, democracy, and economy. However, we know that because of persistent structural racism, Californians of color have been disproportionately impacted by digital inequities, contributing to worse health outcomes compared to their white peers. The overall scale of the problem is improving, but it remains large. The latest survey data we have from the California Emerging Technology Fund found that fully 15% of California residents are unconnected or underconnected to the internet. This number is significantly higher for Latinx residents at 24%, low-income residents at 26%, and shockingly high at 49% for people with less than a high school education. This is also both an urban issue and a rural issue. Central Valley residents have the highest rate of being un or underconnected at 20%, followed closely behind at 19% of LA County residents. So we know that the scale of the problem is large and the inequities are wide. Next slide, please. In our brief that we released last week from TCP, we've broken down the major elements of digital equity into 3 core pillars. These are, first, reliable and affordable broadband, because we know a family can't be connected if they either don't have any physical access to high-speed internet, or if that internet connection is not affordable to them or reliable. Second, adequate devices. Data shows that most Californians have access to a smartphone, but smartphones are not adequate to effectively utilize many types of digital platforms, including many telehealth platforms and many types of educational software. So when we talk about adequate devices, we're generally talking about computers, laptops, and tablets. And third, digital literacy, because we know having an internet connection and a device is not of much use if a person doesn't have the know-how or the support to use the hardware or the online platforms effectively. In each of these areas, we see marked racial and economic inequities, with low-income communities of color having less access to these core pillars than more affluent and whiter communities. There are a few illustrative data points I've shared here on this slide, which I'm not going to read, and I encourage you to check out our full brief for more data and examples of these inequities. Next slide, please. So what are the result of these inequities? This is where I'd like to come back to the concept of digital equity as a super social determinant of health. That's because digital equity or digital access enables the connection to other systems and support that contribute to good health. This slide is not exhaustive, but just shows a few important examples, which I want to mention briefly. Digital access enables participation in telehealth, which I know Marissa is going to talk a bit more about in the next segment. Digital access enables full participation in education for both children and adult learners. And by this, we don't just mean participation in education during the fully remote schooling of 2020, 2021, but just as much today as schools have returned to in-person learning, because kids now do much of their homework, research, school assignments, access educational resources online. So digital access is just as important as textbooks for education today. Digital access also enables economic security. Recent research showed that fully 92% of job postings required some degree of digital skills, and not only traditionally white-collar jobs, but also blue-collar jobs across all sectors. And lastly, at least for our purposes today, digital access enables access to housing and public benefits to which families are entitled. As just one example, in a survey, 92% of workers who were assisting people to apply for housing assistance benefits said that those applicants faced technological barriers to securing relief to which they were eligible. We know that today folks search for and apply for housing and other public benefits online. So as we look at these opportunities that are enabled by digital access, it becomes clear that lack of digital access creates ripple effects for families, interrupting and impeding numerous other opportunities for good health. And it's clear that families of color in California face the most persistent barriers to these opportunities. That's why we consider digital equity a super social determinant of health. And it's why TCP and ITUP as health organizations are committed to addressing this problem. And it's why we see it as one of the most important and urgent health issues of our time. And with that, I'm going to turn it over to my colleague, Marissa Montano, who is the Director of Policy at ITUP. Thanks so much, Marissa.
Yeah. Thanks so much, Maddie, both for your tremendous partnership as we move towards sort of our shared goal for addressing digital equity and breaking down digital barriers to health. And also for grounding us and providing some framework and some data to really identify, that this is a problem and how digital equity is that super social determinant of health. Because that's so core to why, organizations like ITUP are involved in this work. So before I introduce and bring up our first of two panels today, I wanted to spend a little bit of time in just underscoring the opportunity that we have, and also some of the roles that that healthcare stakeholders can play in becoming solutions for addressing the digital divide and advancing digital equity. So, kind of like right now in 2021, the state made an over $6 billion investment in broadband and in closing the digital divide. That's a lot of money. And our advocate friends have said that this is real money and it can make real change. Pair that with this opportunity that we have in healthcare where, contrary to even pre-pandemic, telehealth is a real and tangible, permanent healthcare delivery tool. And that unlocks a lot of things, not just the use of telehealth for folks in our Medi-Cal that is served by our Medi-Cal program, but also innovations in data exchange, innovations in health technology, using artificial intelligence and machine learning to better health outcomes, technologies that I can't even dream about right now. All of this unlocks that potential, but unless we work together, this collective responsibility to break down digital barriers to health, then we can't make good on those on these future of health innovations that can really drive better health outcomes. Next slide, please. So Emily mentioned up front that Maddie talked a little bit about his issue brief. ITUP also put together an issue brief, and I just want to spend a minute or two highlighting a little bit, level setting a little bit. So first, regulation, federal and state regulation of broadband. We're going to hear from Sanford Williams in just a few minutes, who has had a long career with the Federal Communications Commission, the FCC, which among other things, they set the standard at the federal level for what broadband speeds are appropriate and are sufficient for folks, and also are the sort of arbiters of what kind of data do we collect and how do we make that data equitable. Also at the federal level, there's the National Telecommunications and Information Administration, NTIA. There will not be a quiz on all the different acronyms, but I do have them up here. And the NTIA really oversees a lot of infrastructure programs. And a big one is the Broadband Equity Access and Deployment, or the BEAD funding and BEAD program that will drive a lot of digital equity work in California in the coming years. At the state level, there's the California Public Utilities Commission, the CPUC, that initiates rulemaking and regulations around implementation of broadband. So all of these investments, the implementation comes through, the regulation for those come through the CPUC. They also are responsible for collecting and making data accessible. And the California Department of Technology, who oversees the whole Broadband for All initiative. Next slide. So the next couple of slides are really just resources. I'm not going to read them through, but there are a ton of opportunities for everyone to show up and engage and make sure that our voices, whether you're from a clinic, a hospital, a healthcare provider, someone in education, et cetera, showing up as community members to elevate the digital equity needs at the community level is really crucial towards making these state investments work for California communities. And so I put together these next two slides to highlight different opportunities that are coming up to show up and engage. Next slide. And next slide. And so before I bring up our first speaker for the day, I also want to highlight that there are a few roles. There's a lot of roles that we can play as healthcare stakeholders, in addition to the advocacy and showing up and elevating the needs of communities. And I want to highlight a few of them here. We go into a little bit more detail in our issue brief that we released. But the first is, across the state, there are regional collaborations. They're called regional consortia that are funded through the CPUC. These are spaces for partnership and collaboration where you can tap into local projects, local resources, and braid that together with with support at the state level. And this is really a place to build those cross-sector communications that are so needed in order to move, especially local digital equity initiatives forward. We also have a lot of infrastructure and a workforce that we can leverage. All healthcare facilities by statute are considered anchor institutions, and with a little bit with some effort, we can make anchor institutions like clinics and hospitals not only provide broadband within that institution, but also to and through to the community and truly serve as an anchor institution. And then our community health workers can also be positioned as digital navigators. So when someone needs to access telehealth and doesn't know how to use the software for telehealth, there is a trusted messenger that can help them navigate through using that software or enrolling in health insurance, you name it. Data collection is another. We need to be able to identify which patients in California are facing digital barriers to health, and what are they, before we can even start connecting folks to different services and supports. And then finally, I want to plug the outreach and enrollment for an existing federal subsidy program called the Affordable Connectivity Program, which is an internet subsidy program that all those that are eligible for Medi-Cal or WIC or CalFresh are automatically eligible to participate in, and it can reduce or make free internet services. So those are, we can leverage our efforts around redetermination to, for example, or coverage expansion to make sure that folks not only get the coverage they need, but can also take advantage of other existing programs that could help make healthcare more accessible and equitable. Next slide, please. So with that, I hope that you're all really excited for the programming that we have for you today. And I want to introduce, it's my pleasure to introduce Sanford Williams, who has spent his career working to address digital inequities at the federal level with more than 20 years with the FCC, and is currently the special advisor to Chairwoman Rosenworcel and the Deputy Managing Director of the Office of the Managing Director for the FCC. And in addition to that, is a lecturer with UCLA Law. So welcome, Sanford, and thank you for joining us today and for speaking to our audience. So I'm going to hand the virtual mic over to you and ask that you talk to us a little bit about addressing digital discrimination, what role the FCC plays in digital equity and breaking down systemic barriers to broadband and connectivity, and how you think our largely health-focused audience can be agents of change in this work. Thank you.
All right, thank you for the wonderful introduction, Marissa, and thank you, Maddie, for your words earlier. Good afternoon. I very much appreciate the invitation to speak to you all today and the opportunity to be here. It's wonderful. And I love the title of the event, Digital Equity is Health Equity. It's so appropriate and it's so true. So before I get started, I really want to thank also ITUP and the Children's Partnership for inviting me, and all the folks who have put this together. Emily, Marissa, and Shirley from ITUP, and Maddie from the Children's Partnership. I appreciate the work you put into this. And also your work on digital and health equity issues. Thank you very much for that. Now, some of you may be asking, why is an FCC lawyer and special advisor to the chairwoman speaking to us about health equity? And that would be a fair question. So let me step back for a second. I'm blessed to have experienced in a couple of jobs which fuel my passion for and broad understanding, I believe, of the need for equitable access to broadband. Before I moved to California over a year ago, and I should say, I live in Southern California now, I teach at UCLA Law School, and I wrote remotely at the FCC in DC. So I'm able to do a bunch of things here in Southern California, which is great. But before I came here, I was an elected school board member for almost 12 years in Manassas City, Virginia, and I was also the chairman of the school board for 3 years. In addition, I also worked for over 15 years in medical practice while at the FCC. My wife, Dr. Anastasia Williams, a pediatrician who currently works at San Fernando Community Health Center here in Southern California, but she's a pediatrician. We've been married for 35 years. We have 3 children, Kiara, an entertainment lawyer here in California, Sanford, my son, who's also a pediatrician who lives in Texas, and my daughter, Nia, who's a singer-songwriter who lives here with us in California. Now, I mention this because Anastasia owned her own pediatric practice for 15 years, and she loved free labor, so she always put the kids and me to work. And part of my job was being the business manager for the practice for our office, which had over 5,000 patients for the 15 years. So I got a lot of exposure firsthand to the medical field. I also served on the board of the physicians group at the UVA, University of Virginia Hospital, and was very immersed in patient care there and got really immersed in telehealth while I was there as well, especially because it overlapped with the pandemic. Those experiences clearly illustrated and brought home to me firsthand the importance of broadband, and during the pandemic, how essential it was for many of our patients, both at UVA Hospital and my wife's practice, to use telehealth extensively. In my wife's practice, we noted a difficulty in accessing telehealth apps in our practice, sometimes because the broadband access was not robust enough to our patients, sometimes because the facilitators of the apps did not have language translators. Fortunately, my wife is fluent in Spanish, so it's not an encumbrance for her in communicating with patients, but many patients said that in talking with other doctors and other healthcare encounters, they had issues with trying to, if not get on the app, then talk with their providers because of the language barriers. Robust broadband access is necessary for both digital and health equity. So the necessity of broadband access is something our patients had to have to obtain quality care. And in fact, I mean, without being dramatic, it could be the difference between life and death. And let's segue back to something Maddie talked about earlier, which is great. The Children's Partnership report they released on digital equity, they posited there are 3 core pillars of digital equity: reliable and affordable broadband, adequate devices, digital literacy skills and support. I think those pillars are spot on, and they're applicable to both digital equity and health equity. I also love that the report notes, and I quote, "As a result of persistent structural racism, Black, Indigenous, Latinx, Pacific Islander, Asian American, and mixed race communities have been disproportionately impacted by digital inequities." I think part of the work that you all can do is recognizing these facts, and as you practice, keep them in mind as you service your patients. And I'll get to which I think you can do more later, but I wanted to mention that here. Now, on the federal level, my work at the FC is very gratifying to me, in part because I feel like I'm able to help make a tangible difference in the lives of others. One of the items we're tasked with at the FCC is to provide national leadership to address broadband access and digital discrimination. And I believe that digital discrimination, my definition at least, is the lack of access to digital or broadband resources. I serve a few roles, as was mentioned earlier, at the FCC. Much of it involves facilitating broadband access. In my role as Deputy Managing Director of the Commission, I oversee the entire administration of our $14.2 billion budget for the Affordable Connectivity Program, the ACP. And I also lead a task force that Chairwoman Rosenworcel appointed me to prevent digital discrimination. I love working with Chairwoman Rosenworcel because she's very, very passionate about the broadband access, and she in fact coined the term the homework gap years ago. So working with someone who's very passionate about broadband access like I am is very cool. But back to the FCC. All right, I found a quote which said that trauma leaves imprints on body, mind, and soul. And I kind of feel like the pandemic is left the imprint of trauma on the US in many ways. This trauma was exacerbated by inequitable access to broadband. One of our goals with the FCC is to ensure that every person, and that means every person in the US, has equal access to high quality, affordable broadband internet access service. Never has the need for such access been greater. From telehealth to education to work, everything in our country deserves, and I think, in fact, must have equal broadband access. I told one of my classes at UCLA that they may or may not be surprised to hear this, but my perception after working in DC for about a quarter of a century is that folks in DC and on the Hill can sometimes be myopically focused in the DMV, as we call it, the DC, Maryland, Virginia, focus so much on what's going on in the Hill, not realizing that there's so much more going on around the country. However, when it came to broadband in the pandemic, this is one of those few issues where I felt that folks on Capitol Hill and DC and everyone was on the same page, looking at this as a national issue. As part of the Infrastructure Act, Congress devised the ACP to give us the $14.2 billion to promote broadband access to Americans, which is great. To date, our funding has assisted approximately 18 million Americans obtain broadband access, which is excellent, gratifying, it makes me feel wonderful. However, we also have to note that it's not quite enough. So it's great, we love it, but we need to do more. Other FCC broadband initiatives include our telehealth program, which relates to you all. In March 2020, Congress gave us $200 million to establish a program to help healthcare providers offer telehealth services in response to COVID-19. And in December 2020, Congress gave us an additional $250 million for a second round of funding for the program. We have some other telehealth efforts going on, which I'll return to in a moment. We also recently required what we call broadband nutrition labels, which tells providers that they have to let consumers know exactly how fast the speeds are of their broadband provision. And we also established recently our first comprehensive nationwide broadband map, which NTIA was mentioned earlier is using to give out funds for broadband access to states. With our quest to address inequitable broadband access is our proceeding to address and prevent digital discrimination. Congress and the IIJA told us, listen, we want you to look at, find, and prevent discrimination so we can, kind of eliminate this problem. And they told us we had to have goals in the Infrastructure Act, the IIJA, as I referenced a second ago, by November 2023. We are actively working on that now, and we've got lots of information from the community, which hopefully will help us. Back to telehealth. Now, we realize that health equity is a huge problem in the US and how telehealth can relate to that and digital equity. So we have established at the FCC something called Connect to Health FCC. And that's the word connect, the number 2, and the word health, then FCC, all one word. Not sure who came up with that, but Connect to Health FCC, and I think the link is in the chat. This group, and the purpose of this group at the FCC is to help explore the intersection of broadband, technology, and health, and show the future of healthcare. Kind of something as an umbrella for all FCC health-oriented activities to help enable better and more healthier America. 2019 research that we have on our website indicates that counties and any quintile of broadband access, they have on average 9.6% lower diabetes than counties in the next lower quintile of access. What that basically means is that with something like diabetes, the better and more robust the broadband access, the less the incidence of diabetes. And the difference is significant enough that you can't just attribute it to error, that broadband access and ability to get help seemingly impacts folks having diabetes. And that's just for diabetes. I'm sure there are other conditions, as we know, maternal health care, which suffer because of lack of access to access to healthcare and also to broadband access. There is increasing evidence demonstrating a strong relationship between broadband access, internet adoption, and health outcomes. As such, fostering digital equity and health equity are inextricably intertwined. I'll say it again, fostering digital equity and health equity are inextricably intertwined, which is, again, why I love the topic of this gathering today. The Connect to Health FCC's task force, and I'll say C2H, so I don't have to keep saying Connect to Health FCC. The C2H task force has done some research and work in this area. And one thing they mentioned, which is kind of cool because Maddie mentioned this earlier, last year we talked about how broadband plays a direct and consequential role as a social determinant of health, if not as a super determinant of health. The Advancing Broadband Connectivity as a Social Determinant of Health initiative that we established at the FCC is pursuing this promising research to inform public policy and help close the digital divide in health. The goals of this initiative are multiple fold, including informing policies, pursuing collaborative projects with public and private stakeholders, fostering innovation, and in March 2022, March of last year, the task force hosted a virtual event which gathered public and private sector thought leaders from a variety of disciplines, including telecommunications and healthcare, to discuss issues around recognizing broadband connectivity as a social determinant of health. And that entire full day gathering is on our FCC website, so check that out if you have time. Now, to effectively communicate the depth and breadth of the issues involved with digital health equity, data is very important, very useful. However, one thing I found, and I've told this to my kids, and I can call them kids even though they're adults, but I told this to my kids when they were younger, storytelling is so important in so many ways. And sometimes it can be a memorable and decisive part of any narrative. So for example, for years in my role, I've been telling congressional representatives and staffers in DC, we have a huge issue of broadband disparity in our nation. Sometimes they hear you, sometimes they don't. Sometimes maybe just a couple of rural areas, and maybe just here and there, but we're doing a pretty good job. They didn't really hear you. But after the pandemic, and when I gave folks, which I do now, an example of a college student I spoke with in my FCC capacity about a year ago at Baltimore, she told me that she could not work at home during the pandemic, and she had to leave home every day because no matter what the weather was, she was online. Both her parents were working online, her siblings were online in elementary school and high school. They couldn't all get on Wi-Fi, it wasn't robust enough. So she had to go Starbucks, library, wherever to get access. When I tell folks that story and paint a picture of someone trudging through the snow with a backpack and their laptop and all their books from their classes just to get on Wi-Fi, then they get it. I also sometimes share the example of one of our patients who was contemplating physical harm, who was able through a telehealth appointment during the pandemic to be assisted. That made a difference and that saved their life. So another case where if they had not access to telehealth app and also robust enough access to the internet, who knows what would happen. So we can make broadband access happen across the country, but we need to work hard to do that. As someone said to me recently, you can't get your core mission done no matter what you do, whether it's medicine, education, the courts, whatever you do, you can't get it done unless you have broadband access. I kind of coined this statement in talking with some folks at the FCC about, how do we get folks to understand the importance of access? And the statement is that your zip code should not determine your digital destiny. And I think that kind of aptly describes the fact that folks everywhere need access to it. Now, if you're wondering how you can get engaged or help, but let me tell you a quick story, then I'll give you some thoughts that I have on that, and then we'll have time for questions, I believe. So I've spoken at several functions in California, and one function I spoke at, I think it was earlier this year, gave a speech, and during the speech, I was trying to cut it down and condense it, like I did for the speech today, and I took out a reference to the fact that folks with disabilities often have less access to broadband than other folks do. Check it out, didn't think much of it. Went through the speech, and someone came up to me and she said, and this is her exact words, "I love your speech, Professor Williams, but I'm disappointed that you didn't mention the issues with broadband access that folks with disabilities like me have. And I went from feeling satisfied with giving a speech to like, oh man, what did you do? Why'd you take that out? I thanked her for her comments. I told her she was 100% correct. And that interaction taught me something invaluable. For a fleeting moment, I thought my speech was all that. Like I was on point and I was great. And I think it was pretty good overall. But it led me to really think about everything that I say when I talk to folks like you all. And my first piece of advice on your engagement is that whenever you speak to folks about these issues, really think critically about what you are saying and what you are not saying, because it affects so many folks. My next suggestion for engagement is that you listen to people when they tell you their story. All stories may not be helpful, but you can learn something from almost everyone. We talk to folks every day in my capacity at the commission, and I learn so much from folks around the nation about their access, whether it's in the health industry, courts, school. I learn so much from different folks, ages range, obviously, but you can learn from folks, so listen to folks. Now, in terms of participate and follow what's going on at the national level. I think Marissa had a great sheet where she kind of showed what's going on at the NTIA, the FCC. Pay attention to that because it affects you on a daily basis. As I mentioned, we have a digital discrimination proceeding. We have telehealth funding initiatives. We have a Connect to Healthcare project. Request a meeting with us. Go online, look up FCC Chairwoman Rosenworcel. You see my picture up there and her staff. Send an email to one of us. Say, look, you know, I have something to tell you. I want to meet with you. Because we can meet virtually, especially now, doesn't cost anything and you have time. We like hearing from folks to help inform our decision making. So reach out to us. And if you don't know how to do that, you're not sure about it, shoot me an email, I'll help you out with it. At the local level, go engage and as much as you can and become involved with CPUC, California Public Utilities Commission proceedings. They affect broadband as well. Become a digital navigator, as was mentioned as well earlier. Teach digital literacy skills. Reach out to groups like cities, the LA City, which is doing a great job. Counties, LA County is doing a great job also. I'm familiar with those that live here. School systems, ITUP, the Children's Partnership, Everyone On, which is a national organization based here in California. Utility Reform Network, the Nicholson Foundation, the California Community Foundation, religious and community organizations. There are tons of folks involved in these issues and you can find somewhere to step in and help. As I get close to the end, I want to kind of veer off topic for a second and mention something that I mentioned every time I talk, and I've done this recently during the pandemic especially. I find that during the pandemic, talking to my wife and my son and his wife, who's also a physician, that they've seen a great rise in mental health challenges since the pandemic, and I'm sure many of you have seen that as well. And oftentimes, folks like you all are here, you give your lives to serve others, but you don't take enough time for yourselves. So one thing I told my staff, which I mentioned to them, and they can tell you by verbatim now, because I repeat this to them often, I tell them, you are not required to set yourself on fire to keep others warm. You are not required to set yourself on fire to keep others warm. Doesn't mean you don't help people, but means take care of yourself and your mental health, because that's important. The last quote I found came from a book I read recently, Why We Can't Wait by Martin Luther King. Wasn't talking about the digital world, the digital equity, because it was written by Dr. King, but the quote was powerful, and I'll repeat it here because I kind of think how it reflects how many folks feel when they're disengaged from society. And after this quote, I'll be done with my talk and hopefully have time for questions. And the quote is this. It says, perhaps it is easy for those who have never felt the stinging darts of segregation to say, wait. But when you have seen vicious mobs lynch your mothers and fathers at will and drown your sisters and brothers at whim, when you see the vast majority of your 20 million Black brothers smothering in an airtight cage of poverty in the midst of an affluent society, when you find your tongue twisted and your speech stammering as you seek to explain to your 6-year-old daughter why she can't go to the amusement park that's been advertised on TV, and see tears welling up in her eyes when she's told that Funtown is closed to Black children, and you see ominous clouds of inferiority beginning to form in her little mental sky. When you are forever fighting a degenerating sense of nobodiness, then you will understand why we find it difficult to wait. There comes a time when the cup of endurance runs over and men and women are no longer willing to be plunged into the abyss of despair. A lot of folks in our society have been plunged into the abyss of digital equity and health equity despair, and we cannot and we should not leave them behind. So thank you all for helping me in the effort to not leave anyone behind. And hopefully we have some time for questions, and thank you for listening. Those can be kind of challenging to Zoom, but thank you. I appreciate it.
Wow, thank you, Sanford. I wasn't prepared for how emotional that got at the end, and I think your quotes really stick with me. You know, both not being on, both you don't have to set yourself on fire to keep others warm, and you know the time is now to have action. I want to urge folks that if you have questions to post them in the Q&A box. But since we have a few minutes for questions, another aspect of digital discrimination and redlining that you didn't really touch on, but maybe you have some thoughts on, is there's been a number of so with the ITUP's focus, our population of focus is largely our state's Medi-Cal population, right? And so over a third of Californians are served by our Medicaid, the Medi-Cal program. And so affordability is really important here. And so there's a number of different price disparity studies that show that your neighborhood, if you know, even more honing in and targeting, you know, a Black and brown neighborhood, that might be, you know, 2 streets away from a more affluent neighborhood, are charged more and have worse terms for their internet. Why does that, from your perspective, why does that persist, and what can we all do about it? Because I think that's also another piece to this that's really important.
Excellent point, something I cut out. So it's interesting. I'm very familiar with the markup study, which is in the chat. And Shana England, who's a good friend of mine at the California Community Foundation, did the study in California. So we're very aware of that. The proceeding we have right now to prevent discrimination, that's been brought up. And we've gone back and forth with folks talking about the studies, and then providers talking about why they think that it's not quite, you know, accurate. But just to answer your question, two things. One thing that I think, this is me personally talking, the disparities you find often kind of mimic redlining. So where redlining occurred, you have a lack of infrastructure, and you kind of mimics lack of infrastructure. So I think that lack of infrastructure kind of feeds into lack of broadband access. So there is definitely lack of infrastructure. And because I'm a regulator looking at this, trying to be arbitrary, I'll try to walk a fine line. I have seen these studies. I have seen compelling evidence which shows a disparity in offerings and affordability. And I can say that it's quite evident that there's some validity to those disparities. And we are looking at that, and that's one of the things we have to address, because if we have total access but it's not affordable, then what good is it? So that access issue and the affordable issue are huge issues, something we're very cognizant of, something I'm very passionate about, and I'm walking a fine line as an FCC regulator. Now, if you're in my classroom at UCLA, I can be a little bit more open, but I'll just say, you know, we're aware of it. That's a great question, great point. Everyone should look at those studies up because they're very insightful.
Yeah, and I think Shirley posted those in the chat for us all. I don't see any other questions, so I'll go ahead and ask you another question, which, you know, I think so you mentioned better maps. How do our maps, you know, can you talk a little bit about how better maps and better data, what data is needed, and how we can leverage data that we need or that we have, or maps that we have, to start to break down those sort of structural barriers to digital equity?
Great question. So better maps are important. We recently went with a contractor to do a national kind of survey of the maps, the broadband map. And what the broadband map tells us is that for every place in the country where it's broadband being offered and provisioned, and the speeds at which is being provisioned. Now, historically, we've had to only rely on providers, which providers are cool. Some of my best friends are providers. I work in there, but not necessarily accurate. And the problem with the maps also is that, for instance, if you were in a community and there were 10,000 houses, let's say, and 10 houses could get access to broadband, but the other 9,990 could not, they could say, we're offering broadband in that area, and all 10,000 houses will be thought to get broadband. It's important because the money that NTIA is giving out, they got from Congress, is predicated on where broadband is being offered. So it's important that we know where broadband is offered so we know how much money to give to folks, and kind of commensurate with that, know for the offering what the speeds are that are being offered. The broadband speeds currently are 25 down and 3 up, 25 megabits down, 3 megabits up. I mean, no, this is me taking my FCC hat off. That's not enough for broadband. It's not. It really isn't. We are working to increase those, I believe, to 100 to 25, meaning 100 megabits down, 25 up to be broadband, which is helpful. And something else that's kind of related to that as well is oftentimes in the past, some providers would say we offer broadband, meaning that we can get up to a maximum of 25.3, but in reality, when you do a test, you'd see it's like 5.4 or something really minimal. So now with all these things we're doing with the mapping, with the speed, with the broadband nutrition labels, we can find out where broadband is being offered. And then the money that Congress has given us, we can disperse it to the areas to build up the infrastructure so folks who don't have access, first find out where folks don't have access. And then when we find out where they have access, help them get it by saying, okay, we know where it's being offered, where it's not being offered, and we'll go forward from there. So all very important issues. And folks here can help by that because with the broadband map, you can go online, fcc.gov, look at where you are. If what it says on our map is not matched, you fill out a form, send it to us, and we'll look into it.
Thank you so much. This has been really wonderful, and we're just about time to move on to our next panel. But Sanford, I want to, so much gratitude and thank you for your time, your expertise, and most of all, your passion and your ability to connect these issues. And thank you to the audience for tuning in and staying with us. So with that, I'm going to hand it back over to Maddie for our final panel. Thanks again.
Well, thank you so much, Sanford, for that presentation and your insights and your recommendations, and for really sort of lighting a fire under us for the urgency, the action that is needed on this issue because of the severe impacts it has on people's lives. Really appreciate that. And we're going to really use that to drive this sort of third and final portion of our event. And I want to also, just before we jump into this, give a shout out and recognition to Shirley at ITUP, who's doing an amazing job with all of the links, giving people all of the resources and so forth. So thank you so much, Shirley. I'm going to introduce a panel in just a moment, but this last section is really focused on what are the timely action opportunities at the state and local level here in California. What are some of the opportunities for each and every one of us to get involved to make the kinds of changes that Sanford challenged us to make? Just before I introduce the panel, I want to just mention that in the TCP brief that we released, we have a set of policy priorities, which I'm not going to go through all today because we didn't want to host a 4 or 6 or 8 hour webinar, which we certainly could on this topic. So I just want to mention, please go and check out those policy priorities. They are recommendations to the US Congress, to the FCC, to the California legislature, and to a variety of California executive branch agencies. And if you have questions or thoughts about how to get involved in those, please reach out to me and we'd love to work with you. But in this segment, we're going to hone in on a sort of smaller number of action opportunities to explore. So we can go to the next slide, please, and I will introduce our panelists for what we're calling our fireside chat, which we hope is going to be a conversation. We're going to have Marissa again as a panelist on this portion of the agenda to really dig in on her expertise. We also have with us Cabria A. Payden, who is a legislative assistant to Assembly Member Chris Holden of California's 41st District. Really appreciate you being here, Cabria. And we have Kevin Shimamoto, who is the Vice President and Advisor to the Chief Information Officer at Valley Children's Hospital in the San Joaquin Valley. Thank you so much, Kevin, for being here. And just to start us off, and again, trying to use some of that fire that Sanford offered us, we're going to get into the weeds of some of these details in this portion of the event. But we want to stay grounded in like, what is this for? Why are we here? So I wanted to just ask each of you in just 30 or 60 seconds, what does success look like? If we achieve what we're trying to achieve for digital equity, what does success look like? And I'm going to start with you, Marissa.
Yeah, thanks, Maddie. I think this is probably the easiest question I'll get all day, because success really looks like all of those pillars, the pillars of digital equity that you mentioned earlier. It means that those are a non-issue for accessing healthcare in the way that you want it, the way that you need it, and the way that best supports you.
Awesome. Thanks, Marissa. Cabria, we'll go to you next.
All right. Well, good afternoon. Thank you so much, Maddie and Marissa, for having me. I'm really excited to be here. And with that being said, what is digital divide? That has been the talk of the legislature for the past few years, especially with the pandemic. Just open our eyes just how important broadband access is to so many Californians, as we're seeing them struggle during the pandemic with school, with healthcare, with jobs. We've understood that, hey, this is an issue that we need to tackle, and we need to be in the front and show exactly our values as a state. And so for us, digital divide and how to solve that is really equity, really getting at all the pillars that you guys discussed earlier. How are we ensuring that Californians have availability to broadband? How are we ensuring that it's affordable? How are we ensuring that it's quality of service? And how are we ensuring that we're even investing in digital literacy? How are we making sure that we are supporting Californians so that they're successful in this day of age? So for me, success in digital divide is making sure it's equity through and through. And with that being said, I'm really happy to be here and really excited for this conversation.
Awesome. Thank you so much, Cabria. And Kevin, we'll go to you next.
Hi, everybody. Thank you for having me here. Well, we see success here in the Valley. Sanford talked about the lower the LA area and talked about what's going on down there. We're in the Central Valley here. Represent about 50,000 square miles for children here in the San Joaquin Valley. What I see is digital literacy. You know, we have such a wide range of people who want to know how to use the internet, how to hook, just a simple thing as an iPhone and hooking it up. Those are some of the things, both from people that are not English speaking, as well as people who are even older people who have no idea how to access the internet. What I'd like to see come out of this would be people being able to have access to healthcare, have it done at affordable internet connectivity, as well as the speed. The speed is a big issue. And as we see in all of our Zoom sessions, we see some audio issues that happen time in and time out. It's very frustrating for the physicians to try to get an assumption of what's going on, in our case, pediatric children's. And we have about 1.3 million kids that we take care of. And a lot of them are very frustrated because they could connect, but they cannot get the answers they need because of the access or the non-access, as well as being able to see the kids be able to get the medicine, get the help they need in a very short period of time versus having sometimes traveling a half hour, an hour just to go one way. So that would love to see some of those things be taken care of. Thank you.
Great. Thanks, Kevin. We really appreciate you being here today. So I'm going to kick this off with a couple of questions, and we're going to try to do this conversationally. I also want to invite participants, feel free to put questions in the chat as this conversation progresses, and we will try to weave those in as we go along. We're not going to do a dedicated Q&A section, but I'm going to try to pull out questions from the chat if you have them. So feel free to drop those in at any time. So I'm going to start with you, Marissa. You talked earlier about how the state has made significant investments in broadband and closing the digital, and closing the digital divide. Can you give the audience an overview of some of those policy and programs and describe from your perspective how we can all continue to build on this momentum and progress?
Yeah, thanks, Maddie. So like I mentioned earlier, there are a ton of initiatives underneath the California Broadband for All initiative that folks can get engaged with. Everything from building internet backbones, or you might hear that referred to as the middle mile initiative, or in bringing internet to the home, which is when you hear of the last mile. And there's a ton of different ways in which to engage. I want to kind of dive a little deeper into two different opportunities. The first is right now, the California Department of Technology is really honing into creating what's called the State Digital Equity Plan, or SDEP for short, if anyone's following my acronyms. So the Digital Equity Plan is the blueprint that is being created right now that will essentially allocate the funding coming down from the federal government to address digital equity. why that matters right now is because there are a ton of different ways to provide input into what will be the draft plan. And then further formal comment after the draft plan is released to make sure that the digital equity solutions that are put into that plan, where the funding will go, is inclusive of healthcare. And so, for example, someone mentioned in a question earlier, like what kind of supports are there for community health workers in digital navigation? That is a perfect example of something that the state digital equity plan can address. There can be a dedicated program or support or development of curriculum. And there are some examples across the state of folks that are trying to do this now, but there can be state support to create those programs as an example. And so right now there is a health outcome area work group, which is a specific subgroup of meetings. And the last one is next week, next Thursday, June 16th. And you can show up at that meeting and really elevate what are the digital, Stanford mentioned earlier that we need to listen to each other. We need to listen to people who are having these challenges. That's the perfect place to be heard and to elevate up what digital equity issues there are in healthcare. We need healthcare, like telehealth specific software for digital navigation. It can't just be computers 101. It has to be tailored toward what is needed to engage in healthcare, among other, digital skills and literacy training. And so I think it is definitely, there's right now they're being wrapped up. There are regional meetings that happen. There's also a survey, and I don't know if Shirley, I'm going to reiterate that Shirley's being a rock star with all the links and resources she's dropping. But there's a digital equity survey that you can give your input as soon as you're done listening to this webinar. And so that is one opportunity. The other opportunity is less of a state opportunity, but is ingrained in state opportunities. So just like healthcare is local, broadband and digital equity also needs local solutions. It needs local collaboratives. It needs local coalition building, which I'm so glad that Kevin is on this panel with me today because he has some insights into this. But we need, in order to really leverage the middle mile, the last mile, the state digital equity plan, all of these different funding, investments, opportunities, programs, et cetera, to make better health outcomes. We need folks to come together at the local level, the local health ecosystem, to build solutions that are tailored to folks at the community level to make them really work. So I'll hand it back over to you, Maddie. Thank you.
Awesome. Thank you so much, Marissa. Those are really helpful. And we'll make sure people have the links to follow up as well. Shirley's put some of them in the chat about how you can get involved in some of those opportunities over the next few weeks and months. But I wanted to turn to you next, Kabria. Assemblymember Holden is leading the efforts on AB 41, which is a bill in the California legislature to advance digital equity. So first, we want to say a big thank you to him for his leadership on that. Please pass along our appreciation to him. But I don't see any assembly members or senators on this, so I can say this, Kabria, we know the staff do most of the work at the Capitol, so thank you to you for your work on that. We know you and your staff colleagues don't always get a lot of credit or visibility, but we know you work really hard, long hours under difficult conditions, so thank you, we appreciate you. And why don't you just ask you a little bit about AB 41 so folks can understand it. Now, if you look at the title of this bill, it says something about video franchising. So Kabria, like we're talking about digital equity. Why the heck are we talking about a bill for video franchising? Is this about are we trying to bring Blockbuster back? What is this about?
Well, thank you so much, Maddie, for just acknowledging the work that goes on in the building and just the honor it is to really work for Assemblymember Holden, who has actually led the charge specifically dealing with cable video franchises, not only this year with AB 41, the Digital Equity and Video Franchising Act, but last year with his AB 2748. He has continued to be a member that puts himself first in a lot of hard conversations, looking at our government. What can we do differently to hold different industry partners accountable and obviously get the most back to our communities in an equity-based way. So with that being said, AB 41 is one of those bills that are more complex. And basically, it's dealing with cable video franchises because the reality is a lot of the franchise holders in our state, which are gifted through the community, amid the PUC, Public Utilities Commission, they deal with broadband. A lot of our cable franchise holders, there's about 28 now, they actually consist of they make up the most internet service providers in our state, and they serve the most Californians when it comes to broadband. As of right now, we can see that Spectrum as well as Comcast actually serve 85% of Californians. And with that being said, this is a bill that looks at the process that deals with the franchise, granting franchises, It's a bill that focuses on accountability, equity, and it gives the PUC the power that's under the Federal Communications Act to allow them to enforce build out of the service territories that they actually draw themselves. So this bill really is about, hey, how can we make a process that's more equitable, that allows more Californians to get connected, but at the front is, hey, let's raise these anti-discrimination standards, because current law, they're very low, they're easy to meet. And at this point, seeing the impact that of the pandemic, as I mentioned before, how many Californians were disconnected, the impact on their access to healthcare service, their impact on their education, jobs, etc. At this point, it's like, hey, let's see how we can hold these providers accountable in a way by using the tools that are granted to us. And so Mr. Holden has led the charge. I've definitely had a lot of conversations with other staff in the building. We're very excited about this bill. It just passed off of the Assembly floor last week. And with that being said, it's over to the Senate, but we're just really trying to allow people to understand exactly how cable providers are also the largest internet service providers in the state.
Awesome. That's really helpful, Rubria. So I hear you saying that the cable companies, which we might associate with like cable TV, those are the same companies by and large that are providing broadband service. And so if we care about broadband access, we got to talk about cable companies. I think I also heard you say this word franchise, which might feel sort of unfamiliar to the average person, is essentially sort of like a state license to offer cable and broadband service to consumers. Is that correct?
Yes, that is correct. And in addition to having that ability, they also get a chance to use our public rights of way. And the public rights of way just allows them to build out their networks. And what we have been seeing is the fact that they have this great privilege to work with our state, with our communities. However, we have to push them a little bit more to make sure they're building out to our communities, low income, who need it. Especially, I know we just had an amazing presentation that really talks about the redlining that we have seen and following the digital discrimination as well. So this is just a bill about accountability and ensuring that the access to public rights of ways means equal access for Californians.
Awesome. So Cabria, I know that there was legislation passed some years ago, about 17 years ago, if I'm correct, that was trying to address some of these concerns around competition among broadband companies in an attempt to provide better prices for consumers, provide better service to consumers, and avoid some of the concerns about digital discrimination. So that legislation was passed quite a while ago. Why are we still talking about this?
That's a great question. A question that we do get a lot because it was passed in 2006, the Digital Infrastructure and Video Competition Act, with the goals of not only expanding Californians' access to cable and video, but also broadband service because they use the same infrastructure. And with that being said, before it was passed in 2006, a lot of these providers had to go actually to each local entity in order to get a franchise. So this way, and the thought at the time was that, hey, let's have the PUC be the sole authority and issue these franchises in a very quick process, just to increase the competition, which thus would decrease the cost of their services by offering a triple play of services, including video, cable, phone, broadband, etc. So with that being said, we realized as we were looking over a couple of years, like, hey, why is this digital divide still occurring when we had a law passed that was supposed to increase competition, make it easier for the players to get in and to provide this service to Californians? And we realized oh, wow, we need to literally touch bases and figure out, hey, what do we need to change and strengthen to ensure that we're actually holding them accountable, but ultimately we're giving the PUC the tools and authority necessary to hold them accountable through a longer review process, raising the anti-discrimination section. Currently, it's only 35% of 30% of low-income households that they have to provide service to. And then we also are looking at, hey, how are we making sure that they're building out their service territories and making that something that's mandatory for renewals? And so it's definitely a bill that looks at what we can do differently, and we appreciate the efforts. However, we realize it's not working currently, and we need something stronger to really protect our state citizens.
Awesome. Thank you, Cabria. And I wanted to come back to something Marissa mentioned earlier about these series of studies that looked at price discrimination. And Sanford answered that question very carefully as a federal regulator, and we appreciate the role he plays. But I wanted to just make sure to lift those up a little bit, because we have numerous studies conducted by different entities, some of them with very large sample sizes over different geographies. Some focus locally, like one in LA County, one focused nationally, that really showed very striking and very consistent results, which is if you live in a low-income community of color, you are much more likely to be advertised broadband service at a higher price and at worse terms for the exact same service in a more affluent and whiter community. Now, that is the definition of discrimination. And frankly, intent doesn't matter. Discrimination is about the outcome. So we see this discrimination clearly. You can look at those studies and see that discrimination. Cabria, do you think AB 41 provides us an opportunity to hold internet service providers accountable for that kind of discrimination, which we see?
Yeah, thank you for the question. I didn't mention before, the work that we're doing is obviously possible from Assemblymember Holden, our work as staff, but really our coalition of digital equity fighters. With that being said, the report that you're referring to was by one of our sponsors, the California Community Foundation, and we also have other sponsors, including Common Sense Media, Next Gen California, Unite LA, that really do look at, hey, what's going on in our inner city? What's going on in our rural communities? How can we hold a lot of these franchise holders accountable for the discrimination that we are seeing based on income? So with that being said, with AB 41, I would say we have some very strong anti-discrimination standards. This bill is about equity. And one thing that we can focus on that's not protected is income. So how can we make sure that we are holding these cable providers accountable? And with that being said, this year we had multiple discussions and we decided to raise that 30% threshold to 50% of low-income households in the beginning after 3 years of providing service. And then after 5 years, it should be 100% of low-income households. And we granted the PUC the ability to collect data to ensure that these providers are actually going and investing in communities that they have been avoiding. And with that being said, we are very thankful that we do have an agency that's able to actually enforce this bill in a way that we believe is going to have the outcome of having more access to broadband capable infrastructure, and as a result, lower the prices of broadband and internet service. And in addition to the low income section that we have for anti-discrimination, we also included an actual public forum for renewals of these franchises. So the cable franchises are usually 10 years. After the 10 years, they have to go up for renewal. And during this time, we actually put in the PUC has to invite members from the community, different stakeholders to voice their concerns with the service that they're providing, just to ensure that, once again, equity is at the front of this conversation and that we're empowering people to participate with our government so that we can ensure that all voices are heard and lifted. And in addition to that public hearing that we are including, we are looking at providing build out to the entire service territory as well, which is a new addition to this bill compared to last year. And with that being said, this is something that will help, one, address the donut holes that we're seeing in our cities, and then two, after 15 years of providing service, look at how can they ensure that they're investing and can provide service to their entire service territory. So with that being said, this bill is definitely about making sure the infrastructure is available, holding them accountable, and just really having the data necessary to really track which California households have access to broadband and which ones do not.
Great. Thank you so much, Cabria, for breaking that down. It is a complex piece of legislation, but I really appreciate the way you've broken it down and made it easy to understand and what the implications are. So appreciate your work on that. I wanted to shift over to Kevin to ask you a question. It's great to see you here, Kevin. Kevin and I got to sit next to each other for a full day training that ITUP put on just a few months ago. And I got to hear a lot about the work Kevin was doing in the San Joaquin Valley. So I'm glad to have a chance for you to share some of that with this audience. So Kevin, just as healthcare is local, we know that broadband and connectivity needs local solutions, as Marissa was referencing a few minutes ago. Can you tell us a little bit about the coalition you formed in the San Joaquin Valley, including why did you as a leader of a hospital decide to prioritize digital equity, and how has your coalition been successful?
Yeah, well, thank you for all the kind words there, man. Looking forward to working with you and for a long time as we get through this digital divide type of environment here. Very good question. What came out of the pandemic for us was a few things. One is some of our patients didn't come back. And the question is, why didn't these patients come back? A second thing is we had heard is trust, the word trust coming out from a lot of the families of coming back to a facility thinking that they might get COVID, right? And some of the leaders in those areas, and when I talked about 50,000 square miles, we're talking about a lot of coverage, 1.3 million kids. And then who usually takes care of the kids is the mothers or caregivers. And one of the things I found out is as we're coming out of this pandemic, a lot of the hospitals aren't doing well. We lost a hospital just very local to us called Madera Community. And there's about 40 to 45 hospitals in California, most of them are critical access, that are on the brink of bankruptcy. So what happens? What happens to all the patients? How are we going to care for these patients? I got thinking, obviously my IT background is like, we need to get coverage from a broadband point of view quicker than later because of some of the things that are going not only in California, but across America. There's a lot of facilities that are impacted right now. And I'm sure the state is working on a lot of that side of things. So coming out of that, I figured we need to talk from, I call it from cradle to grave, people that are taken care of along the 99 corridor in California. You can see that in the heart of California is the 99 corridor. And I didn't know what I didn't know about how people can have, do they or do they not have access? But I found out they have access to the street, but they don't have access to their apartments and those dwellings if it's a HUD or lower income areas. So even though it's at the street level, and we had a family of 5 who are trying to do school, and they have zero access in the whole time that they're going through the pandemic. So if they don't have access to do schooling, what are they going to do about medical? And that's one of the things that we were thinking about and started talking to a lot of local agencies, FQHCs, rural health clinics, some of the leaders of some of the towns. And what I found out is, it's not that they're forgotten or everyone puts their head in the sand. It's just that accessibility was a big issue in healthcare, and healthcare wasn't really being heard, I don't think, at the state level as much as we want to get it to. And we were getting bigger and bigger as far as trying to get that advocacy out there. But that was the main reason for us putting something together here in the Valley. Obviously, Maddie, you're down in the Southern California area. It's, you got a denser population, a lot less square miles, but you still have some of the same issues in the urban areas that we do. And so looking for a way, using the talent that we have up and down our healthcare corridor and getting access to our patients. And doesn't necessarily be pediatric, in being that we're a big pediatric area, is trying to develop a coalition that we can be heard and making sure that no child or any patient is left behind to have access in a telehealth arena, or another arena would be obviously to just get the literacy to get connectivity is another big thing that we'll be following very heavily. So that's some of the things that we are the reason why and what we're trying to achieve, hopefully in the next 10 years.
Great, thank you so much, Kevin. So I'm just curious from your perspective, what's the risk if healthcare leaders are not involved in this conversation? What are the risks to health equity, to access to care, if our healthcare leaders sit this out because, we feel like, oh, it's not our thing?
One of the things for me, is that for me, Maddie?
Yeah, that's for you, Kevin.
One of the things is not only literacy, but education for the leaders too. They've got to understand as we move into this digital movement, It's not something that's short term. This is here to stay. I think a lot of them work from home has made a big impact on people not wanting to come back to our hospital. When I say not wanting, but not working full time, they've got accustomed, and I've seen a lot of productivity. If the leaders do not see this, I think we're going to continue to have issues. Having connectivity, having the and legislature needs to be involved in here is what do we have in order to get reimbursed for the telehealth movement? If we're going to move in that way, we see the productivity side, we see the thing called AI and ChatGPT coming up, some of these buzzwords out there quite a bit, but we are in a digital age, and the new generations that are coming, they've been accustomed to the digital age, and we need to make sure the leaderships are educated as well as the ones that are coming through either med schools, leadership who run hospitals. But that's a big part, Maddie, right now is education, not only just from the patient point of view, but also from the people who run the hospitals, from leadership in it. We see that happening quite a bit all over the country as what are we going to do about things like AI, ChatGPT, machine language things. What's this all mean? And how does it's kind of complex to try to explain that, but this is here. Things like being able to do medicine digitally a lot more accurately, more complete. We're getting the genomic side of things. So, but leaders have to be attuned of what's coming. And that I think education really would help in making sure that people across the United States are well educated, in not only from the patient point of view, but also the leadership point of view.
Great. Thank you so much, Kevin. And I wanted to just build on that with a question to Marissa, really sort of in the same vein, because you talked earlier about some of the state processes currently happening related to digital equity. What are some of the ways that you see working on a statewide level that healthcare entities can play a major role addressing digital equity? And I might just add to that, other folks working on, health issues broadly, what are the roles that they can play?
Yeah, thanks, Maddie. And you alluded to earlier that ITUP 2 months ago at this point, in April, we convened what we call the Broadband Boot Camp, where we convened healthcare stakeholders from, state departments through, local hospitals. Kevin and Maddie were part of that group. And actually workshop these ideas to really crowdsource folks that are working in and around healthcare to delineate some of these ideas and some of the roles that we pulled out from that work. Also, we did this in person, which was very fun. We passed around fiber cables and really got in the weeds on broadband and digital equity to break down digital barriers to accessible and equitable healthcare. And some of the solutions that we pulled out were, around digital literacy, not only making digital navigation, content, but making sure that they are in many different languages so that they reach our community, making telehealth available in different languages to bridge that gap, making telehealth and virtual care or other technology more accessible for our older adults in California, and keeping that in mind that we have a large population that might need different types of support around digital, like digital literacy and inclusion. Some other things that were brought up, those of you that are in sort of the Medi-Cal healthcare space, we have a TA marketplace for CalAIM. What about a TA marketplace for digital literacy and inclusion supports that we can connect folks in? Can our healthcare system put that up so that when we do have the data to identify who's impacted by the digital divide and how, we have a place to send folks so that those services and supports are available. Being a pilot studies to figure out how we do that identification of patients and providers that need the digital, they need the support to bring healthcare online in an equitable and accessible way. And I think, so thanks, Maddie. We also have, I think Shirley posted that report in that has a lot of details in the chat, and then we also pulled out some really strong goals in our issue brief. Another one that I didn't mention that's more on the infrastructure side is all health facilities are considered by the federal government to be anchor institutions, meaning that they're kind of a community hub where folks go for access the internet. Other anchor institutions include libraries and schools. Anchor institutions don't just have to be a place that folks come to get access to internet, but we can leverage our existing infrastructure, the infrastructure part of a hospital, a part of a healthcare facility, to actually be that that hub or that pillar for last mile connections out into the community. And there's some federal and state funding to bring those projects on, along with braiding funding from other, competing, other folks in the community, and having sort of this cross-sector engagement to make that work. Yeah, and then I think one other thing that I mentioned a little bit earlier is leveraging, leveraging our healthcare delivery system, our providers, to make sure that if someone needs digital literacy support, needs to be connected to the Affordable Connectivity Program to get that internet subsidy that they're allowed for, that our workforce has the information to connect folks to those services. Thanks, Maddie.
Great, thanks, Marissa. That was really helpful. And I'm gonna turn in a moment back to Cabria, because I want to explore a little bit about how folks can get involved in some of the legislative work. But before I do that, there's a question in the chat from Shelley that I think is maybe most appropriate for either Marissa or Kevin, if you want to take a crack at it, which is just about what kind of funding opportunities are available toward making this change. And especially, I think, thinking about health-focused institutions, health leaders, community leaders, what kind of support is available out there for folks like that?
So why don't you take that first?
Yeah, so there's a couple of different things. It depends on sort of where you're situated and what kind of project you want to move forward. So the CPUC has a number of grant opportunities to support different last mile efforts in sort of local communities. And so there's funding to either build those collaborations if you don't know where to start. You can either engage with your regional consortia that already exist, and Shirley posted that in the chat for how to find if a regional consortia exists. And something to be aware of is that not all regional consortia are engaged in the same way, and not all sectors are represented in all of these regional consortia, but still they are a place to go to leverage, CPUC funding and local funding, and maybe some other investment funding that might be available to drive a digital equity project forward. And then in the future, there's also, I mentioned the State Digital Equity Plan. The State Digital Equity Plan is the blueprint for federal funding that will be dedicated toward digital equity and inclusion projects. And so that is another pot of money that will become available in early 2024 or sometime in 2024 to provide those resources. And then there's building different. When you build a coalition, there's also, you can get some buy-in from different community members to leverage and braid together different funding and resources to not only bring a project online, say, for example, an infrastructure project that might be needed, but also to sustain it. And so there are folks that I'm happy to, if folks want to connect further on finding those different opportunities and those different resources, please reach out and we can chat about it and come up with a plan. Because I think there's a lot of resources out there and more to come.
I want to second that. ITUP has been wonderful for us, our coalition. We need numbers. We need more members. We need people to reach out to us so that we can take it to the state level and make sure we come in from a healthcare point of view. We come from all roads, and no one should be left behind. And that's one of the things why I'm so passionate about this, is because it affects everyone. It's even the affluent people it affects. So, but definitely from the older generation to the newborns, it affects them. And we talked about, we are 80% Medi-Cal at our location. So you talk about 33%, but of the 33%, 80% of our patients are from the Medi-Cal side. So we get it, we're listening, and that's another Maddie, why we're looking at this as an alternative way to help our patients, and that not only for us, but for all patients in our San Joaquin Valley.
Great, thanks so much. And we'll just, for folks, we'll be sharing all the links that are in the chat from Shirley. We'll be sharing those out as follow-up, so don't worry about trying to go through and copy and paste those. We're going to be wrapping up soon, so I just want to come back probably to sort of a final question or two for Cabria in this section about ways that people can get involved in AB 41. And you talked a little bit about a few minutes ago, the ways in which this bill is trying to create more accountability for big internet service provider companies. One of the things we know from public data, those companies are doing quite well. Most of them are pulling in record profits. So I'm curious from you, what are those companies saying? What are you hearing from them? And then on the other side, are you hearing from community members saying we need these kind of changes for the sake of equity in our communities and our families?
Yeah, well, thank you so much for that question, because you are right. They are seeing record profits over the past few years, especially as they're able to expand their broadband network and customer base. So with that being said, they are a lot of industry aligned organizations that are in strong opposition to this bill, similar to last year. And with that being said, because they are seeing record profits, they're able to utilize those resources in a way to really come to the Capitol, have conversations with members, and sway the opinions. And with that being said, even though we do have a lot of large organizations against this bill, we also have a lot of community-based organizations who are on the ground with the constituents, who are impacted most by a lot of our members, and who actually are doing the work to mobilize communities to come to the Capitol, to have conversations with their members, and really show another side to this issue. With that being said, I think that's typical for a lot of bills. When you have strong opponents, we can see just resources utilized better in a sense of money. However, when it comes to, for example, different labor unions, we're able to see them mobilize people in a way around one just cause that can also sway a lot of the legislators here in the Capitol. So with that being said, we are prepared. We understand. However, we have been having conversations to really understand where they're at with the bill. But at the end of the day, because this bill is looking to create a more equitable process that has been benefiting them so much for so long, to see these record profits, they are in opposition. A lot of feedback that we have been receiving is just the build out portion, the low income portion. How are they able to know which households are low income? How are they going to afford to build out to their service territories? And our responses have been the same. There has been, in addition to the $6 billion that we are seeing and becoming, or soon will become invested in California to help with the last mile, middle mile, et cetera, and getting more broadband access to Californians, there has always existed the California Advanced Service Fund, which was a grant program to really help them with the cost when it comes to expanding their networks and broadband capable infrastructure. In addition to the grants, their profits, we've definitely have had discussions in regards to the PUC being the authority to really have a place where they can have those conversations on how to meet these new standards that are outlined in our bill. And so with that being said, our office has been having conversations, connecting with different colleagues of Mr. Holden's that have similar mindsets of just putting the people first against the industry interests. And so far, it definitely has been working. However, I would really urge that people understand the importance of reaching out to their members. And in the chat shortly, we will have a link that will help you identify who your state senator is, who's your state assembly member, so that you can actually pick up the phone, have a call to the office, and let them know just how important it is to have access to broadband. And with that being said, there's also the portal for letters that you can submit based on individual or organization to say you support this bill. And these letters are important because as support and opposition grows, as the bill moves through the legislative process, every staffer in the building gets to see these. Every consultant who works on bills gets to see who's really supporting it, who's opposing these bills, and really what it means for very meaningful legislation to pass through both houses. And I think that's something that we are very appreciative, because we understand that we are fighting a big fight. However, we're fighting a just fight, and a fight that needs to be had in regards to getting more Californians access to broadband.
Thank you so much, Cabria. And I want to build right on that. We're really just in our last minute. I didn't want to cut this conversation off, but we're pushing into our last minute. I want to just ask Emily if you could bring up a slide, because we want to give people an action opportunity and an encouragement, like right now, to take action on AB 41. We've put together this letter, which is specifically about the health imperative for passing AB 41. We want to encourage you to sign it. You can sign as an individual. You can sign as an organization. Take a look at the link. Also, if you can't sign it, right away, your organization may need to review it. You can indicate in there that you're interested and you want to stay in touch, but you can't sign it. You can also let us know if you're interested in taking any other sort of action. So we want to really encourage folks to take a look at that. I'm going to turn it over. We're going to go. I see it's 3. We have about maybe 1 more minute. I'm going to give it back to Marissa for a second for an action opportunity, and then we'll wrap up. So Marissa.
Yeah, really quick. If you are interested in coming together and learning, engaging more on the state digital equity plan when the draft becomes available and the public comment period opens, shoot me an email because we can get you on a list to pull folks together and make sure that healthcare is included in that. And also, if you want to learn more about opportunities to get the word out about the ACP program, also send me an email and we'll get that going. Great. And thank you all so much for joining us.
Great. I just want to say thank you to Kevin. Thank you to Cabria. Thank you to Sanford, everyone at the ITUP team. Thank you for everyone for joining us today. We're going to wrap up. Please take a minute and fill out the evaluation. We'll send it out in the follow-up email as well, but we really love your feedback about what you liked, what could be improved for future events. We hope you will stay in touch. My email and Marissa's email is here. We really hope to see this as a chance to grow and start new collaborations. So please feel free to reach out to us. If you have questions that didn't get answered, if you want to talk about ways we can collaborate, we'd love to hear from you. And with that, we're going to conclude today's event. Thank you so much, everybody. Have a wonderful afternoon.